friends. This is how I spend my time when I'm not showing you my feet. I'm usually barely decent for the camera. I'm working on something, and this is a more awkward video to try to show you than most of my content, but it's super important. And as usual, I like to just come clean with exactly how I'm practicing things in my world. So I've just had a major breakthrough on this, and it's kind of like the dots in the connect the dots picture are getting closer and closer together, and the underlying issue is emerging. So the issue is hip centration. Okay, then I'm holding this tripod somewhat level. There. All right. So hip centration. Here's my acetabulum. Of course it is. Right here's the cup of the hip socket where the femur head sits. Now there's lots of different ways we can have movement in our hip. It's a ball and socket joint, and it's got good suction, at least it should, okay? And like any aligned joint, especially because you're picturing like the hinge of a door, for example, which is not a ball and socket, right? That's like a lateral hinge like this. If you put a lot of weight on the top of that door, you're like me, and you hang way too many jackets on the door, and it starts to sort of bend, right? My wrist isn't allowing me to really show you, but you get the idea. It's bending. It's not well aligned anymore. You're going to get wear and tear in that joint, and the joint's not going to move the way it could have previous to having all this interference with itself, right? With its counterpart of the two pieces that come together. So your hip has some similar dysfunction. And again, I'm not going to make this a massive video about all the different ways that that people decentrate their hips. One of the most common is to have the head of the femur jutted forward. I have a little video from a couple years about hip gripping, and you should absolutely look up. There's links, I'm sure, in the bottom of that video, and we could talk further. But the idea is sometimes if you squeeze your glutes in just such a way that you actually ram the head of the femur forward in the socket, it might not come all the way out, but it's putting extra pressure at the labral rim of the hip socket, right? It's a nice deep socket, and it has soft tissue, almost providing a little extra webbing, and actually it gives it some extra suction, but you can abuse that, and that's people labral tears, pain in the front of the acetabular joint is pinching at the front of your hip is a very common symptom of that. Don't ignore that symptom. It's telling you your hip is not aligned, okay? And you can actually absolutely realign it, but it's going to take mindful movement, which is what brings me to my video today. I don't have a really detrimentally misaligned hip, thank you. But I could be headed that way if I weren't paying attention. All right, so I'm doing the exercises, and I'm practicing the slow tedium of moving my hip joint and not letting it decentrate. And one of the ways you can feel whether or not your hip is decentrating in a lying down position the way I am now, as opposed to standing positions, for example, when you don't have the tactile feedback of the ground, is that when you go to move your hip, your pelvis moves. I'm about to show you from the side. But the idea is if your hip is centrated and you ask it to move, you ask your leg to move in the hip. Of course, these two pieces are connected, and lots of natural functional movements. I just realized the wash is going, and the sound on this video is probably terrible. I'm sorry, friends. Anyway, naturally there's plenty of functional movements when the pelvis and the femur cooperate and move together. But if you cannot move your femur without your pelvis, you're probably borrowing leg movement from things like your back, right? Because your pelvis will be moving when it should be the leg's job. And that is what happens if, for example, when you're lying here and you, my little cheeky self, I'm sorry guys, I just hope you can deal. If I go to lift my leg, you can't really tell, I'll show you from the side in a second. If I go to lift that knee, I'm hovering it a centimeter off the ground. And if I feel the top of my pelvis hit the ground, right? So, like that. I'll show you from the ground. If I squeeze my butt and the top of my pelvis comes forward and the bottom of my pelvis goes up with the leg, that is actually, sure, it's hip extension, and my glutes extend my hip. But if I can't not move the leg without the pelvis collapsing forward, it's just a little movement. If I don't get that initiatory movement clean, it's telling me a lot about the way my whole backside works, literally. the booty muscles, and all down the leg, back of the leg, back of the calf, and into the foot that you know I'm always talking about. Okay, so on this left side, is where I have my challenge. So here I'm gonna lift, I'm just barely lifting that knee, But as I do, and I'm not trying to correct it yet. I can correct it, but here's the default, and this is what I discovered in doing some of my rolling patterns that I have to tell you about, right? So I discovered that when I lift this leg, reflexively the top of the pelvis comes forward. Again, I'm borrowing, hip extension is lifting the leg, right? Your femur is going behind your hip. Hip extension is lifting the leg. Please don't think I can't lift my leg higher than this. It's for the drill and the clarity of the exercise, okay? So hip extension is lifting your leg behind. Your glutes contribute to that. Your hamstrings contribute to that. Your back is not your back's job, okay? But if you move your leg in extension and you can't control that pelvis from going forward, that means every time that hip goes into extension, which it does every time you take a step, you stand on that leg, you push your body forward, your hip goes behind you, that's hip extension. If you cannot achieve that position without that deformity at your pelvis, you are borrowing movement that your leg should do from your back, and that's a problem. All right, so there's our drill. I'll show you a cheekier version of it, but I got incoming neighbors who need to come through as well. Come on through, no worries. You're gonna be famous in my video. All right, so here's what the control looks like. This is uncensored, quite literally, but this is the movement when I don't correct. I think you can see my hip is coming forward. If I use a lot of concentration and I engage my core, there's some air pressure in my core, and I make sure that I'm not laterally shifted onto that side. This all translates to gait. I'm really aligning my ribs over my pelvis, and I can float that hip. Let's see if I can really do it for real. I can float that hip and I can hover it without the top of the pelvis touching the mat. It's such a micro movement. It's so not even capturable on screen, but I want to show you, and I want you to do it with the same level of discipline. I'm extra shiny to this side. All right, I'm gonna lift. This side is so easy. It's so easy. I don't even feel tempted to rock the pelvis forward. Much better aligned. So what does that mean? The femur is doing this without jamming forward. And a lot of trainers will tell you, squeeze your glute, jam it forward, right? Lock out your hips, whether it's at the top of a deadlift, the top of a squat, right? Or even just doing this as an exercise of hip extension. And they will tell you to squeeze your butt to push it forward at your own risk, friends. All right? Nothing wrong with squeezing the muscles you have, but if you are borrowing from your back and if you are stressing the front of the hip socket, you just have to ask, how many reps is it worth it? All right? On your max lift, at your max effort, or in an emergency situation, sure. Lock out your hip and borrow from everything you've got to sustain the tension in the socket. But for just strengthening exercises and for corrective exercise that lends itself to the way you're going to move through space in your just basic walking and running gait, 100% practice it clean and make sure you're not abusing your body as a result.